Good morning. Senate Health, Education, Labor, and Pensions Committee will please come to order. Today we are holding a hearing on protecting U.S. biomedical research. Ranking Member Burr and I will each have an opening statement, and I will introduce today's witnesses. After the witnesses give their testimony, senators will each have 5 minutes for a round of questions. Before we begin, I again want to walk through our COVID-19 safety protocols in place. We will follow the advice of the attending physician and the sergeant at arms in conducting this hearing. We're very grateful to our clerks and everyone who's worked so hard to get this set up and help everyone stay safe and healthy. Committee members are seated at least 6 feet apart, and some senators are participating by video conference. And while we are unable to have the hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov. And if you need accommodations, including closed captioning, you can reach out to the committee or the Office of Congressional Accessibility Services. Our nation has a long history of leadership when it comes to biomedical research, and I am proud to say that Washington State has contributed to several important chapters in that history with groundbreaking discoveries related to bone marrow transplants, cell therapies, and precision medicine to help determine the best treatment for each patient. And with nearly 1,800 NIH awards going to 75 biomedical science organizations in my state last year, we remain a leader when it comes to life-saving research. Protecting and supporting that research has always been important to families and patients across the country. But the COVID-19 pandemic has put a spotlight on the value of this work in developing treatments and cures for diseases, the importance of promoting global collaboration and information sharing in the biomedical research community, and the need for transparency and accountability to ensure this work is based on data and science and protected against undue influence of any kind. That means protecting scientific work from political interference, like we saw from the Trump administration, as well as protecting it from undue foreign influence, which can take many forms. Global collaboration is critical in biomedical research. Talented researchers from around the world have played a key role in some of the major breakthroughs our country has made. In fact, in recent decades, more than a third of the Nobel Prizes in medicine, physics, and chemistry awarded to Americans were awarded to immigrant or foreign-born scientists. Our ability to lead the world in biomedical research is directly tied to our ability to work with the world on biomedical research. But successful collaboration requires trust, and trust requires transparency. It's important that researchers with foreign affiliations and potential conflicts of interest, for example, participation in foreign talent programs, or commitments to file patents in or move laboratories to foreign nations, fully disclose those issues when applying for federal grants. It's not that researchers can't have other affiliations, but they must be transparent about them, and the overwhelming majority of researchers are. The latest report from the National Institutes of Health on undisclosed conflicts of interest found cause for concern with only 507 grant recipients compared to over 30,000 total grantees in 2020. But we cannot let the few instances of bad actors undermine the U.S. biomedical research enterprise, including our ability to partner with talented researchers around the globe. We also have to protect confidential information, for example, unpublished research or sensitive human genomic data from being improperly shared. That means protecting against threats like the cyber attacks we saw last year when North Korea tried to hack COVID-19 vaccination data, and bad actors who misuse their access to research, including during the peer review process. The National Institutes of Health has made progress in implementing policies and procedures to raise awareness of, prevent, and address undue foreign influence among the biomedical research community. But as investigations from the Department of Health and Human Services Office of the Inspector General, the Department's Office of National Security, and the Government Accountability Office make clear, there is more NIH can be doing here. So I'm pleased to have witnesses from each of those offices, as well as the NIH Office of Extramural Research, which investigates grantees who are credibly thought to have undisclosed conflicts of interest. I look forward to hearing more from each of you today about what steps Congress can take to ensure accountability and transparency in the grant process. Families are counting on us to get this right, not just to make sure their tax dollars are not misspent or intellectual property isn't stolen and national security isn't undermined, but so potentially life-saving research on cancer and Alzheimer's and other diseases is not delayed or derailed by undue influence. Congress has a long record of bipartisan support for biomedical research. I'm proud to have fought hard to make necessary investments in this work, and I hope we'll be able to work in a similarly bipartisan way on this committee to take steps to protect those investments. With that, I will recognize Ranking Member Burr for his opening remarks.
Thank you, Madam Chairman, and